Hello, nice to meet you all. I'm Yuno Choi from Korea Differently Abled Federation, a disability advocacy organization. So we are working for the advocacy of disability rights. So it is such an honor to participate to this virtual meeting organized by KDF. Shortly, I'm going to talk about disability inclusive COVID-19 pandemic response of South Korea and further path to go. Okay, here's the content of my presentation. First, difficulties faced by the person with disabilities during the COVID-19 and provision of the government and the contributions and works by the CSOs. So in Korea, the total population of South Korea is approximately 52 million, and total confirmed cases are 22,000. It's like 0.04% point per total population, and the deaths are 367. And the daily confirmed cases of 15th September were 113. So I'd like to look through the disability-related incidents in South Korea. The first confirmed case of South Korea was found on 20th January. It was an imported case. And on 19th February, the first Korean confirmed with the virus was found in Cheongdo Daenam Psychiatric Hospital. So in just 3 days, 102 out of total 103 patients in the hospital were confirmed and a patient died of COVID-19. And on 23rd, in Daegu City, near the hospital, the person with disabilities and personal assistants and the center staff went under self-isolation. And on the same day, a person with kidney disorder died of COVID-19. And person with disabilities and social workers were confirmed in the residential institutions. And in other institutions also there are confirmed cases broke out. All the schools, including special schools and disability facilities in communities, had to close since the end of February, which resulted in the blank of disability support and care. And the facial mask is quite important protective equipment, but person with disabilities cannot access to the pharmacy, so they cannot buy really the masks. So the government introduced 5-day rotation system for purchasing masks. So the difficulties of person with disabilities have been mitigated a little. However, as the second wave has come again in South Korea, the social distance level rose, and the difficulties that the persons with disabilities confront are still prolonged. So let me tell you the detailed obstacles persons with disabilities faced during the pandemic. Despite of a high risk of rapid infection in the institutions, including psychiatric hospitals, nursing homes, and disability institutions, but government had no tailored manual, so it was just collective isolation only. And in case of self-isolation, there was no proper guidance for using personal assistance service, so persons with disabilities had to stay in the home alone without any personal assistance. And also the visual and person with visual hearing impairments, they cannot access to the informations properly. And at the test At test rooms also there was no sign languages. And also the persons with kidney disorder were also the biggest victims, as 14 people died of the virus merely for 2 weeks. So, they are with weak immune systems, so they should have been classified as a highly vulnerable group in the COVID-19 response, but they were not classified as the highly vulnerable group. So they had they were being down at the list of the hospitalization. So they had to take the risks. And due to the closure of welfare facilities, care and support blank post care burden on the family members of the person with disabilities. And online classes are inaccessible for the students with hearing, visual, and cognitive impairments. So the government also made the response for the person with disabilities. So the K quarantine, we called it. So there are 3 T's. So the South Korea introduced fast test system, which able to test 15,000 to 20,000 people per day. And then after that, when the confirmed case, we trace them promptly. Like we traces, the government traces GPS log, credit and debit card records, medical treatments records, and other CCTVs, and using QR codes so that we can trace the confirmed cases. And the process is semi-automatic. And treat means the prompt isolation of the confirmed person. So the special care center for mild patients and negative pressure wards for severe patients. So the core factors of the K quarantine is the protective goods. For facial masks, personal protective equipment, test kits, they are needs for the minimize the infection of the medical team. So the strong manufacturing industry is very important. And online shopping and logistics infra are essential to prevent social chaos such as a pandemic panic buy. So the PPEs can be smoothly provided. And IT and communication infrastructure are also core factors. South Korea actively utilized virtual meetings. And okay. Okay. South Korea actively utilized virtual meetings and other IT infra so that minimize the infection, the risk of infections of the virus. And the Korean government also limited the shutdown to minimize the economic damage. But in this case of limited shutdown, the combined public awareness and infection prevention responses is quite important. So the governments kept trying to raise the awareness raising on the infection prevention responses so that people should always wearing masks in public. And the disability inclusive COVID-19 response by the government. So the government provided emergency disaster relief funds. It's in cash to all the citizens. And we are going to provide the EDR again. And to prevent the person with disabilities lose their jobs, so the government also provided disability employment support fund um, to the companies. And for the self-isolation, the people, they provided the in-kind support like self-quarantine relief pack and PPE support to the person with disabilities. And also for the students with who had to use the smart devices, also rent the devices to the students with disabilities. And social service, like for the hearing and verbal persons with hearing and verbal impairments, they provide 24/7 consultation center. And the government also made the COVID-19 response a disability inclusive manual and non-face-to-face medical treatments. And also, as the CSOs kept asking for that, so the sign language translation now is provided all the time when the in government provide the information. The government tried to listen from the CSOs and they tried to react promptly. However, still there was gap. For example, in residential institutions, the collective lockdown was only the manual at the first stage, and also some people were not classified as mild cases despite of underlying conditions, so some people died of that. And also there was no guidance for using personal assistance in case of self-isolation. I think it is due to the blank, the gap, the current gap of the disability policy of Korean government. So we are kept requiring the high risk classification of the persons with underlying conditions and providing protective equipment and accessible disaster safety information. So we kept made our voices heard, the CSOs. For example, we piled a petition to the National Human Rights Institute about the discrimination against the psychiatric persons with psychiatric disorder who had to be in the hospital collective isolation. And also we asked to accessibility of the information. And also the right to education of the students with disabilities. So the Ministry of Education is working on the accessibility of the online classes. And we also liaise the donator and recipients on the personal equipments, protective equipments, and we also participated to making the inclusive manual. As this is pandemic, so it's worldwide crisis. So, but we have to in this pandemic situation, we CSOs should find problems of the persons with disabilities are facing, and we have to publicize the issues and presenting resolution in on behalf of the persons with disabilities. And also we have to we have to provide information to the government about the needs of the special needs of the persons with disabilities, and we have to co-work to make out the solutions. Thank you for listening. And if you have any questions, please please ask me on the chat room or email me. Thank you.